Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, feel free to give me a call here in the Fort Wayne area by dialing 969-2720. Or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, I am broadcasting live every Monday night from my spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, Dear Dr. Fawver, my brother, 68 years old, is diagnosed with schizophrenia. He's on medication and has regular doctor visits. He's up one day and then down for a couple days when he stays in bed and doesn't eat. He only takes his medications when he is down. I'm his caregiver and worried about this pattern. Any suggestions for this? Thanks. Well, I'll tell you what, it sounds as if your brother with schizophrenia might also have a phenomenon called schizoaffective disorder. You might have heard that term. It's where he's having bipolar symptoms, where he's having highs and lows in his mood. The bipolar symptoms, bi refers to two, polar means one extreme or another, and you can indeed experience bipolar symptoms in the midst of having schizophrenia. Now, schizophrenia, as you're probably aware, is a condition that's a day-to-day phenomenon where you'll have difficulty processing thoughts, difficulty communicating, socializing, even taking care of yourself to some degree. With schizophrenia, people often have hallucinations when they're not well, and they'll see things and hear things other people cannot see or hear, and they'll often have difficulty with the perception of the reality around them. We call that delusions, where they'll have fixed false beliefs and they will insist things are happening that can't possibly be happening. That's the schizophrenia part. That's a day-to-day phenomenon. Now you have, on the other hand, bipolar symptoms that can come and go. The highs are characterized by decreased need for sleep, racing thoughts, impulsivity, feeling on top of the world, and perhaps elated or even irritable. Then you can crash into the big lows. The big lows characterized by extreme fatigue, social withdrawal, wanting to sleep all the time. It's indeed during the big lows that people often are most troubled, and that's when they sometimes will take their medication. You know, if somebody's having schizoaffective disorder, they're having the highs, the lows, they're having the schizophrenia symptoms day by day. They might want to be on a long-term injectable if they're having trouble remembering their medications. A long-term injectable medication will be a shot anywhere between once a month, every 3 months for that matter. We have some medications that will go every 3 months, and there are medications indeed in development that can go even less frequently than that. But these long-acting injectables will basically give you an ongoing blood level of an antipsychotic medication in your system. It'll be a lower level than typically given when you're taking oral medications. So with oral medications, with oral antipsychotic medications, you'll get blood levels that are really high, causing you more side effects. The side effects typically are directly related to the blood level of the medication. So with oral medications, you'll have high blood levels, then they go down a bit, then higher, and then going down when you take the day-to-day dosing. When you have a long-acting injectable, it'll stay in your system at a therapeutic amount, but not going so high that you can have side effects. So many people will say, number one, the long-acting injectables are more effective in the sense that you're keeping a medication in your system week by week, month by month for efficacy, but number two, they'll be more tolerable. So the long-acting injectable medication will be more tolerable typically. So if your brother is having difficulty remembering to take his medication, especially when he's feeling on the high side, he might need to have a long-acting injectable. And for many people, it's tolerable, and there are many means by which it can be affordable for individuals who need those kind of medications. Thanks for your email. Let's go to our first caller. Hello, Carson. Welcome to Matters of the Mind. Carson, you had mentioned that your anxiety won't allow you to push through difficult situations. So you wonder, how can you push those feelings like you're stuck in the mud? Well, the first thing you ought to do, Carson, is try to find a peer, a colleague, somebody who can kind of go along with you in those difficult situations and give you emotional support, or at least get you started in those kind of difficult situations. Number two, start with thinking, okay, if I don't do this, pursue this difficult situation, that indeed, by the way, is a decision. If you don't do something, that's a decision. Number one, you might have regrets if you don't do it, but okay, so what if you do it? what's the worst thing that can happen? So if you are to speak in front of a bunch of people, think about the worst case scenario and think through that and consider, okay, if it happens, you typically will conclude, so what, and you move on. And it's a matter of just getting started and giving it a try. So many times when people take on a difficult situation, they'll find that other similar situations in the future become easier and easier. That's called coping mechanism. And in your brain, you have a phenomenon called neuroplasticity. When you take on a difficult situation, Carson, it actually changes the structure of certain areas of your brain in a good way because you're learning how to cope with that. Next time you tackle a difficult situation, it becomes a little bit less anxiety provoking for you. So trying to achieve one thing at a time, not only does it give you confidence, but it physically is changing your brain for the better. So Carson, I'd recommend trying to have a peer or a colleague trying to get you going along with it. Number two, thinking about the worst case scenarios. If you happen to fail, keep it in mind that not starting on something like that is a means by which people fail. But number three, just realizing that trying to do something that's kind of challenging is actually good for the brain. And it's a good exercise for the brain, not unlike going out there and trying to run a 5K. Maybe you're not very good at running. You don't feel like you're in the physical shape yet to do it. Go out there and give it a try. You muddle through it, and next thing you know, you start wanting to train for more 5Ks and get better at running. So the same thing is with a challenging situation, Carson. You'll notice that when you take on challenging situations and you overcome them, you get more confidence. But hey, from my perspective, you're also changing your brain structure. Thanks for your call. Let's go to our next caller. Hello, Diane. Welcome to Matters of the Mind. Diane, you want to know what's the diagnosis of someone who laughs at everything and thinks that everything is funny. Diane, it's not a psychiatric condition unless it's causing what we call functional impairment. In other words, if you're laughing inappropriately, particularly episodically, where it's causing you trouble with socialization, it's actually getting you terminated from your work situation. Maybe you're laughing out loud in school in totally inappropriate manners. It all comes down to the context of the laughing itself. People who are in good spirits, so to speak, and they're laughing at different things, hey, that's partly a coping mechanism if they find that things are funny, but it's not a pathological psychiatric condition unless it's causing them trouble with school, with work, or socializing. So I take that all in the face of context, Diane. Some people will find humor in situations, and again, humor, it's great to see in situations as a means of coping with horrible situations sometimes. But when you find humor in inappropriate situations and it's getting you into trouble, that's when it becomes a diagnostic condition. Diane, thanks for your call. Let's go to our next caller. Hello, Jenny. Welcome to Matters of the Mind. Jenny, you want to know what is food addiction, and is it a matter of poor willpower? Basically, food addiction is a real phenomenon, Jenny. People will notice that they get somewhat of a high when they eat certain foods. These are foods that will increase dopamine. Many times they are sweets, refined sugars. People will kind of differ in various ways on how they respond to foods, but basically, if some foods give you a little bit of a high, it's a dopamine surge, and the dopamine surge comes from this middle part of the brain called the nucleus accumbens, right in the smack in the middle there. It's the front part of the brain looking at you. That's the inside part of the brain, and the nucleus accumbens can give you a little bit of a surge in dopamine with certain types of foods, and usually it's sweet, high-sugar foods. What happens then? Well, you get the tryptophan fired up in your brain. Tryptophan will then lead to the production of serotonin, and for some people, they can actually get somewhat of a calming effect. If you blast yourself with a bunch of carbohydrates, you can get an increase in insulin very, very quickly in your body. Insulin will increase the transport of tryptophan into the brain, and that leads to an increased serotonin in the brain. So for many people, they get actually a neurochemical change when they're undergoing this type of food addiction. Now, any kind of an addiction means, by definition, that you're craving something and you need more and more of it to get the same effect. And if you don't have it, you can start feeling really, really lousy. And to some degree, for instance, people can have a caffeine addiction where they need a higher and higher amount of caffeine to get the same effect. And if they don't have that kind of effect, they will notice that they use higher amounts of it, and then without it, they feel worse. That can happen with some kind of foods. Is it willpower? Yeah, the main willpower aspect would be to try to avoid those type of foods, identify which foods cause you to feel worse, and be very careful using those kind of foods in moderation, and be aware that they can be triggers for you to make you feel lousy. So if you notice that every time you eat cupcakes you feel worse, yeah, it could be the sugar, it could be the gluten, whatever, but if you identify that the cupcakes make you feel worse, you probably need to limit, if not eliminate, the consumption of cupcakes. But if you do eat them, make sure that you commit to only eating a half or a very small amount, because you need to remember certain foods will trigger you feeling worse. Thanks for your call. Let's go to our next email. Our next email reads, Dear Dr. Fawver, my friend from another state called me, excited and just a little nervous, but not distressed, saying they were getting messages from aliens. And they said they were still taking their medications, thought to be Seroquel with other medications. Did they have a psychotic break? What could have caused this? Will it resolve itself? How can you help? Well, here's the deal. Get that friend of yours into seeing their clinician. If they're comfortable using the Seroquel and various other medications, these medications can be used for individuals who are having trouble with loss of reality. If it's an ongoing condition, it might be somewhat of an exacerbation. Thank goodness they did call out to you, and your friend feels enough trust in calling out to you. But sometimes mention to your friend that aliens, okay, we're not going to get into a debate whether aliens exist or not, but in the context of their having concerns about aliens, my next question for your friend would be, okay, how did you get this idea? Do you perceive that they're talking to you in your house? You know, people have seen the drones in the sky. They've seen all these new satellites coming up in the sky. So they might have a perspective that might not be entirely unrealistic, because they see things that possibly could be the case. Now, a true delusion is where it's not possible for these type of things to happen. But if aliens has been part of their delusional process when they were ill in the past, that's where they can see their clinician. So the thing you can do as a friend is make sure they are taking their medication, because the Seroquel, for instance, can help people with schizophrenia and psychotic disorders to stay in touch with reality. If they merely say they're seeing aliens because of all the drone encounters that have been occurring, and they perceive the drones are aliens, and that's been their interpretation. That not necessarily is a psychotic type of condition that you'd want to consider. That might just be not an unusual interpretation of the reality around them. So I think it all comes back to their past history. Are they taking their medications? And make sure they get in to see their clinician at this point, and try to encourage your friend to do so. Thanks for your email. Let's go to our next caller. Hello, Nolan. Welcome to Matters of the Mind. Nolan, you want to know if irritable bowel syndrome can lead to anxiety disorders. What's the relationship between the gut and the brain? Irritable bowel syndrome can be either constipation, diarrhea, or a combination of those type of things. And as you can imagine, we do indeed hear about people with irritable bowel syndrome having anxiety. If you can imagine having the abrupt onset of diarrhea just out of the blue, that's going to create a lot of anxiety. So on one hand, the anxiety will make the irritable bowel worse, and that's where I often hear about irritable bowel as a psychiatrist. And when I treat somebody for anxiety or depression, and I always want to know, do they have other medical comorbidities like irritable bowel syndrome? Because if they have irritable bowel syndrome, I want to try to address that the best I can. For instance, if they have severe diarrhea as part of their irritable bowel, I want to give them a medication for their anxiety or their depression that might be somewhat helpful in decreasing the diarrhea. Same will be with constipation. There are some medications that are very good for individuals with severe constipation in the midst of their having depression or anxiety. So I'm going to try to tailor my medications to try to help them with that, because you're exactly right. Irritable bowel, anxiety, they will go back hand in hand, and each will make the other much worse. Thanks for your call. Let's go to our next caller. Hello, Mark. Welcome to Matters of the Mind. Mark, you want to know about how you approach your doctor about microdosing of psilocybin for anxiety or depression. It's not Food and Drug Administration approved at this point, Mark. Keep your ears open to the news over the next year or two. It might be FDA approved for a condition like post-traumatic stress disorder. I think we're probably 5 years away, perhaps, to see psilocybin being used mainstream, but you had it right when you used the term microdosing. It's being used at tiny, tiny, tiny little doses for the purpose of indirectly affecting serotonin in fairly unique ways. And what's different about psilocybin compared to a medication like Spravato or esketamine will be psilocybin, the intention of the treatment over the course of 3 and 4 hours in a session will be, number one, to get a hallucinogenic type of effect. And during that time, you are to be accompanied by a therapist, and a therapist will take you through different exercises during that hallucinogenic experience. That's psilocybin. With esketamine or Spravato, it's a nasal spray where people might have what's called dissociation. They'll kind of have an out-of-body experience anywhere between 20 minutes and 1 hour after getting the first spray. They're monitored over the course of 2 hours. The dissociation is not hallucinogenic necessarily. It's not intended to be associated with its effectiveness. So if you don't have dissociation during Spravato treatment, that's not a bad sign. So the dissociation during Spravato treatment is a side effect, it's an adverse event that is not needed for effectiveness. With psilocybin, on the other hand, the hallucinogenic experience is expected and it's part of treatment. That's why a therapist sits at your side and guides you through some guided imagery during that time. Thanks for your call. Let's go to our next email. Let's go to our next email. Our next email says, Dear Dr. Fawver, my mom got me a journal for Christmas to help with my anxiety. Can journaling really help with anxiety? Journaling is phenomenal for anxiety, and I often recommend that people keep a worry diary. What's a worry diary? A worry diary is where you write down, preferably early in the evening or late afternoon, not right at bedtime, but you write down your main worries for that day or even for that week if you're just doing weekly journaling, and you write down your main worries and you take a look at your main worries that you have at this current time and you sort out, okay, here's what I can do about them, and you have a little plan on what you're going to do about them. Tomorrow I'm going to do this, this, and this to address this worry, this worry. A lot of worries you have no control over, and Mark Twain once said, I have known a great many worries and 90% of them have never happened. So if you think about your worries, it's a waste of brain power to worry and ruminate and dwell about things if you don't have any control over them. If you have control over them, okay, do something about them. Anxiety actually is a normal reaction to your brain and body trying to get you nudged to do something about your current life circumstances. So anxiety is not all bad. Anxiety helps motivate you to get going and get started on getting something addressed. But if you're worrying about something, about the future, about things you can't control, that's a whole other matter. So number one, journaling will help you keep track of what your current worries are and have a plan for how you're going to address those. But what's great about journaling is after about 3 months or 6 months or 1 year, look back on your previous worries. Look back on the worries that you had a few months ago. You'll typically see that they were addressed. The worries you were enduring at the time never happened, and they just worked out. And that can be very reassuring to people. If you can look back on your worries that you had in the past and thought, oh yeah, that was no big deal, this or that happened, you'll find that the worries you had a few months ago, and especially 4 and 5 years ago, they worked out. You know, God took you in a different direction, and that's what so commonly happens for all of us. And it's just part of our life's plan, and things don't work out necessarily the way we expect them to do, but you'll find out you can get great reassurance in knowing that things work out if you just kind of you tackle different challenges the best you can and based on your current awareness, and don't worry about the things you can't control. Let's go to our next caller. Hello, Sean. Welcome to Matters of the Mind. Sean, you want to know what's happening in a person's brain when they switch in the handwriting style in mid-sentences, like starting with an open number 4 and moving to a closed number 4. It might be part of normal handwriting where people do have a variation. As a psychiatrist, I'm going to look at that a little bit more in detail, Sean, because there is a rare but significant syndrome called dissociative identity disorder. It does happen. It used to be called multiple personality disorder, where people, when they used to write back in the old days when people used a pen and paper and they wrote, they could change their handwriting in mid-sentence or toward the end of the page as their personality changed. So as you might infer, dissociative identity disorder is where somebody is under stress they have a trigger that might trigger them into a different personality. It's a real phenomenon. I have seen it occur with some people. It's quite rare, but they will actually change their handwriting in the midst of their writing, and they might go to a more childish handwriting, or it might be more loopy based on their personality. So their handwriting will follow their personality. So that's the worst case scenario. But otherwise, if somebody is having pretty much a normal mood and they just have a change in their handwriting in one sentence, I wouldn't think much of it. I think that would be a normal variant. But as a psychiatrist, you know, when somebody asks me a question like that, I'm always thinking about the worst case scenario, and then we move back from that. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, how can I prioritize my mental well-being this year? And what are some good habits or new routines that I can implement to support my mental health? Well, number one, you want to try to identify habits and routines that you are motivated to truly pursue. And most importantly, what are you going to get out of it? What's going to be the outcomes? Track the outcomes. And secondly, make yourself accountable to other people. Let other people know you are going to do this or that, and have them check in on you every now and then on how that's doing, or bring it up to them on how you're doing with it. So number one, you want to have a goal or a routine that's achievable. Don't do something that's outrageous. You want to do something within your capacity. Otherwise, you just set yourself up for failure. But do something within your capacity and something that's achievable, but track how you're doing with it. And we always believe in tracking outcomes on how you're doing. Small steps at a time. It's not a all or nothing type of phenomenon with a routine. Let's say you are trying to get into exercising 3 times a week. Well, gee, you got busy one week, you went on vacation, you missed a week. That doesn't mean you totally failed. Just get started on it again. So it doesn't mean that you have to have the same routine every single week. More often the better, but you're going to have times when you don't have that routine. Many people will have a vow toward quitting smoking, and that's a great goal to try to achieve, to quit smoking. But with quitting smoking, you want to try to realize what are the benefits. Talk to other people about your goal to quit smoking and why. You know, you might slip up every now and then, have a cigarette or another cigarette once in a while. That doesn't mean you're a total failure. Just go back to trying to stay off of it. The more you stay off of a bad habit, the more likely your brain will actually change. And again, that's called neuroplasticity. Your brain changes in the midst of your performing new habits and new routines, and your brain gets used to those routines. And the more you stay with it, the more likely your brain will just notice it being something that's expected. So you want to try to get into that routine on a regular basis, but realizing if you miss out on doing that routine once in a while, it's not that big of a deal. Just get back on the horse. Thanks for your call. Let's go to our next caller. Hello, Tammy. Welcome to Matters of the Mind. Tammy, you want to know about a lucid dream. What's a lucid dream like for someone with Parkinson's disease? Is it a really bad dream, or is it more realistic? I'd say both of those phenomena can occur, Tammy. When somebody has Parkinson's disease, they have a disruption of dopamine in their substantia nigra, and it's thought that the dopamine transmission decreases by as much as 30 to 70%. The substantia nigra is this little dark body right in the middle of the brain there, and it's responsible for spewing out dopamine, and in doing so, it gives you smooth body movements. People who have Parkinson's disease will often walk without much of a arm swing. They might have a little bit of a tremor. They might have a little bit of slurring in their speech. People with Parkinson's disease might eventually start to have some cognitive disturbances, but not always. So with Parkinson's disease, people can have difficulty with various types of symptoms, such as when they walk and they're swiveling to turn around. They might need to kind of have a shuffling gait, we call it a festinating gait, but it's where they have a change in their gait when they're trying to turn around. So they walk almost like their feet have concrete in them as they're walking along. Now, a symptom of early Parkinson's disease can be bad dreams, and the bad dreams can be, on one hand, part of the Parkinson's coming, but on the other hand, people can have bad dreams or lucid dreams, as you had mentioned, related to the medication. So if they're taking medications increasing dopamine, sometimes increasing dopamine can give you the very clear, vivid dreams. And yes, they can be perceived as nightmares, especially if people aren't accustomed to having dreams prior to their medication treatment or prior to those particular symptoms. But Parkinson's itself early on can be associated with such collateral symptoms as bad dreams, lucid dreams, or even restless legs. We hear about that not uncommonly. So it can be related to the Parkinson's itself, but sometimes the very clear, distinctive dreams can be related to the treatment for Parkinson's as well. Thanks for your call. Let's go to our next caller. Hello, Grace. Welcome to Matters of the Mind. Grace, you want to know what are the side effects for medications that are used for obsessive compulsive disorder. The best medications for obsessive compulsive disorder, Grace, are these so-called serotonin reuptake inhibitors. Those have been the most thoroughly studied for OCD, and these medications include medications like fluvoxamine, also known as Luvox. We typically use sertraline or Zoloft. Fluoxetine or Prozac will often be used for OCD. A medication that came out in the early 1990s was clomipramine, anafranil. Works a little bit differently. Anafranil or clomipramine is an old tricyclic antidepressant medication. That means it's going to give you really bad dry mouth, sometimes lightheadedness and weight gain. But the serotonin-like medications can make you feel a little bit mentally dull and emotionally dull. You might notice you don't feel happy or sad. You just kind of feel blah. And sometimes people will have sexual disturbances and sometimes restlessness from those. Everybody's a little bit different on the kind of side effects they might have with the serotonin medications. But for OCD, we're often cranking that dosage up a little bit higher than we would for anxiety or depression. So that's the big difference. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now on YouTube. Thanks for watching. Have a good evening.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.